If you're searching for answers about CSATs or certified sex addiction therapists, you're in the right place. This is for you if you're feeling overwhelmed by compulsive sexual behaviors. You're ashamed, you feel isolated, you don't know where to turn, and you're looking for help to treat your sex addiction. You are not alone, and I've been there. I'm Craig Perra, and for over the past decade, my team and I have been empowering men to break free from sex addiction, a journey rooted in my own personal failures and struggles with the traditional treatment models. So, what is a CSAT? A certified sex addiction therapist is a mental health professional, a counselor, or a therapist trained specifically to help individuals struggling with sex addiction. The CSAT certification was developed by Dr. Patrick Carnes and is rooted in the 12-step model of addiction recovery commonly used for alcohol and drug abuse. Experts say the CSAT training emphasizes a trauma-informed approach and integrates elements of the 12-step philosophy, viewing sex addiction as a disease that can be managed but not cured. The disease model positions compulsive sexual behavior as an uncontrollable condition like other addictions, focusing on lifelong sobriety as the primary goal of treatment. There are many great CSAT therapists out there, and I've worked with a number of them over the course of my decade helping people, and I include a link below to help you find one. But here is where it gets tricky, and if you're struggling, you need to know this. Did you know the concept of sex addiction and the role of CSATs treating sex addiction are subjects of significant debate? While CSATs focus on treating these behaviors through the addiction lens, many experts explicitly reject this approach, and let me explain. So, CSATs are members of a professional association also founded by Dr. Carnes called the International Institute for Trauma and Treatment Professionals. Another professional association, in fact, the oldest in the United States regarding human sexuality, is the American Association of Sex Educators, Counselors, and Therapists, and they say not so fast. They say the sex addiction treatment model falls beneath the standard of care and isn't supported by a scientific understanding of human sexuality. One of their members actually wrote a book entitled The Myth of Sex Addiction, and here's what they cite as their evidence. A lot of people don't know this, but the American Psychiatric Association does not recognize sex addiction as a formal diagnosis in the DSM-5, their primary diagnostic model. They rejected the sex addiction model after extensive research and 5 years of both field and clinical trials. The World Health Organization, while they include compulsive sexual behavior disorder in their diagnostic manual, the ICD-11, but they do not classify it as an addiction. They call it an impulse control disorder, and that matters when it comes to treatment. Some common criticisms of the CSAT model include, number one, some experts say it's too problem-centric, focusing on sobriety without addressing the underlying mental health issues. Others say the CSAT model overemphasizes abstinence rather than fostering healthy sexuality. And last but not least, they say the model lacks scientific support. So if you're looking for help, what do? Number one, whatever the modality, find someone you connect deeply with. The single greatest predictor of results in a coaching or therapeutic relationship is what's called the therapeutic alliance. And what that says is, independent of the modality, you're going to get the best results when you really connect with the person who's helping you. Second, whoever you work with, remember these 4 important points. First, number one, the behavior is the symptom. The compulsive sexual behavior is always the symptom of deeper underlying issues that drive the lying, the ability to compartmentalize, the lack of empathy, the poor coping strategies, the low self-esteem, and shame. 2, to break a habit, you have to make a habit. So this means you should be obsessing, not over breaking habits, but of making new habits that produce the outcome of sobriety, that produce integrity, healthy sexuality, and a great life. Number 3, the longer I've been helping people, the more this lesson crystallizes, and that is sobriety is a small part of the solution. That's an important step, but that doesn't produce healthy sexuality and a great life. Number 4, one lesson that I learned over helping people for 12 years, the cure for your addiction is the aggressive pursuit of a great life. If you want to beat this, you got to feel good about yourself. You got to take great care of yourself. You need community, accountability, vulnerability, and purpose. That's the aggressive pursuit of a great life. So, if you're looking for an approach that blends the best of the healthy sexuality and the addiction model, consider my program, The Mindful Habit. So take action. Click the links below and find someone who can accelerate, deepen, and help you sustain your journey. Find a CSAT, find an ASEC therapist, join my program. Whatever you do, do something. And please be sure to like and subscribe if you want more videos about sex and porn addiction or more videos about creating healthy sexuality and a great life. Thanks for watching.